Welcome to the Mountain View Safety Services Site-Specific Health, Safety, and Environment Orientation. Site-Specific Hazards. There are hazards that are inherent to every work site that you will operate on. Ensure that they are identified. Examples of hazards can include those that are overhead, underground, hazardous gas, high pressure, chemicals, permitted operations, etc. Site Rules, Vehicle Parking Requirements. Identify vehicle parking requirements for your job site. These can include, but may not be limited to, parking areas, back in, face out, escape routes, use of spotters. Site Rules, Facial Hair Policy. Prior to entering the work site, you must ensure that as a minimum, head hair is not below the shirt collar when in a normal standing position. Note, hairnets may be used to confine long hair, provided that hard hats still fit properly. All workers will be clean-shaven daily. For workers who are required or may be required in an emergency to wear respiratory protective equipment or resuscitators, the effectiveness of the equipment depends on an effective face seal. The worker shall be clean-shaven where the face piece of the equipment seals with the face, for instance, the nose cub. Fit testing requirements. Workers who are required or may be required in an emergency to wear respiratory protective equipment or resuscitators, a fit test is required on that particular piece of equipment to ensure an effective facial seal. Designated smoking areas. Workers are to identify designated smoking areas at the worksite and at camp should they be necessary. There is absolutely no smoking in company vehicles. Area electrical classification. Non-intrinsically safe electrical equipment are not allowed in areas where combustible gas is or may be present. Gasoline and diesel engines without automatic air shutoffs are restricted from entering some areas. Personal protective equipment. Medics will be required to wear the following basic PPE: long pants and sleeves, or flame-resistant coveralls for industry work, hard hat, safety glasses, CSA-approved work boots. Some job sites may require site-specific safety equipment in order to be compliant with contract or company requirements. It is the responsibility of the employer to provide specialty safety garments or coveralls. Mountain View Safety Services will provide coveralls to medics requiring them. All PPE must be kept clean, free of rips or tears. Inspect all PPE daily. Any defects found must be reported to management or dispatch, and replacements will be organized. Training. Proper training for the work to be performed is required. All field employees are required to attend and participate in quarterly competency-based training. Lifting and hoisting. Mountain View Safety Services employees are not permitted to use lifting or hoisting equipment on site. No person should ever stand or walk underneath a suspended load. When loading patients into the MTC, the medic is to direct the lift, not participate in it. Medics are to verbally direct all stages of the lift and ensure the patient is safely loaded into the MTC. When the patient is to be unloaded from the MTC, the medic is to verbally direct the unloading process. Medics do not lift. WMIS and TDG requirements. Current WMIS and TDG tickets will be required for all field staff. WMIS and TDG are company-specific courses, and although you may have tickets already, you may be required to recert and obtain Mountain View Safety Services tickets. Know the location of MSDSs on site and in your truck. Communication requirements. All MSS trucks are outfitted with a base-to-truck radio. This will be used most often to call kilometers on resource roads and access roads. Company phones will be issued depending on individual project requirements, including increased usage, reporting, designated number for the site ERP, etc. Cellular boosters are hardwired into each MTC. They are generic and will boost any provider in nearly any area. Keep in mind there are dead spots that even a booster cannot adequately reach out of. In cases where regular check-ins are required and or extremely limited communications is available, Mountain View Safety Services will provide either a Garmin InReach GPS unit or a satellite phone to the job location for use of medics on site. Any deficiencies found with communication must be reported to management or dispatch immediately to be replaced promptly. Emergency response. Workers are to identify all potential emergencies, for instance, medical, spills and releases, fire and explosions, vehicle accidents, etc. Complete an ERP and the WorkSafe BC first aid assessment at the beginning of each job. Describe the emergency activation signal, alarm, or medic call for the worksite. Identify muster area locations. Describe relevant details of the emergency response plan, such as responsibilities, communications, and contact info. Identify the location of medical and emergency response personnel, facilities, and equipment, such as medic, trained first aid workers, first aid room and kits, location of material safety data sheets, showers and eye wash stations, SCBA, ambulance or conveyance vehicle, fire extinguishers, smoke and heat detectors, alarms.